Assalamu alaikum. I am Dr. Zuhaib. You all have been familiar with the term hypertension. So, what is hypertension? Hypertension, which is also known as high blood pressure, is a long-term medical condition in which we have the persistently elevated high blood pressure in our arteries. Now moving towards the epidemiology of the hypertension. According to the World Health Organization, 1.28 billion of the adults from age 30 to 79 years old have hypertension, and approximately 46% of the adults have unknown hypertension. Now moving towards the types of the hypertension. Types of the hypertension are divided on the basis of etiology and on the basis of values. On the basis of etiology, we have the two types. The first type is known as the primary hypertension. The second type is known as secondary hypertension. In primary hypertension, we have the known etiology. In secondary hypertension, we have the known etiology, and we have the diseases like Cushing disease, and we have the endocrine disorders, and we have the renal disease and coarctation of aorta. Now moving toward the types on the basis of values. On the basis of values, we have the four types. The first type is known as the pre-hypertension. The second is known as the hypertension stage 1. The third is known as the hypertension stage 2, and the last is known as the pregnancy-induced hypertension. In pre-hypertension, we have the systolic blood pressure, which is 120 to 139 millimeter of the mercury, and the diastolic blood pressure is 80 to 89 millimeter of the mercury. In hypertension stage 1, we have the systolic blood pressure, which is 140 to 159 millimeter of the mercury, and we have the diastolic blood pressure, which is 90 to 99 millimeter of the mercury. And then we have the hypertension stage 2, in which we have the systolic blood pressure, which is more or equal to 160 millimeter of the mercury, and we have the diastolic blood pressure, which is greater or equal to 100 millimeter of the mercury. And in pregnancy induced hypertension, we have the enzymes and hormones that increase during the pregnancy and cause hypertension. Now moving towards the risk factor of the hypertension, which are of two types, modifiable and non-modifiable. Modifiable risk factors include the consumption of alcohol, tobacco consumption, excessive salt intake diet, obesity, physical inactivity. And non-modifiable risk factors include the age, ethnicity, and familial history. Now moving towards the pathophysiology of hypertension, which are of four types. The first is the systemic or sympathetic system activities. The second is known as the activities of the vascular endothelium. The third is known as the activities of the renal system. And the fourth and the last is known as the activities of the endocrine system. Now moving towards the symptoms of hypertension, which includes the chest pain, anxiety, decreasing breath, and we have the last and the most important is the nosebleeds. Now moving towards the diagnostic evaluation, which includes the physical and medical examination like medical history, and we have the history of diabetes mellitus, chest x-ray, ECG, and CBC. Now moving towards the management, which includes the lifestyle modifications like decreased salt containing diet, and we have the alcohol consumption and tobacco consumption stopping, and the most important is the physical activity. Pharmacological therapy includes the drugs like antihypertensive drugs, like we have the ACE inhibitors, diuretics, thiazides, and we have the alpha blockers, beta blockers, and calcium channel blockers. Now moving towards the complications of uncontrolled hypertension, which include the hypertensive retinopathy, hypertensive nephropathy, and we have the heart failure or stroke. Thanks a lot.